Hello there. We'll be running through the reproductive system today. So, just a little refresher, female reproductive system. We have the ovaries, the fallopian tubes, which are not connected, these little fimbriae or fingers hanging off here. They actually capture the egg. So the egg can fall in the abdomen here, okay? Here we have the uterus and then the vaginal tract, urinary, so bladder, rectum. Okay? So, hormones. Follicle stimulating hormone. So, if a woman is not having a regular menstrual cycle, typically what that means is there's either lack of eggs, so you're talking like menopause, or there is not the appropriate stimulatory hormones. So, what can be done is if you give follicle stimulating hormone, well, the problem is we overshoot. And so this is where you end up with like the 8 kids, okay? Just octomom. That's what's happening, okay? So the risk of having multiple births at the same time is increased. So a lot of times when they say when you see triplets and up, it's due to fertility shots. That's typically what's going on there, okay? Luteinizing hormone. So this is released, if you remember covering this at some point, when the follicle or the egg is about to be ovulated. So the cells that are surrounding the egg directly, they release a surge of estrogen. The granulosa cells is what they're called. And so that surge of estrogen stimulates the release of LH. LH causes the egg to be released from the ovary or ovulated. Right? So what happens is during this time, progesterone and LH are climbing, the body temperature increases as well. So a woman can track her body temperature and know when she's about to ovulate. Okay? Progesterone, estrogen, these inhibit the release of FSH. So if there's no FSH released, there is no egg production or maturation. So will she still ovulate? No. Okay? Do women make androgens? Yes. In the periphery, there is conversion. So they do have some testosterone, but very low levels. And what causes menarche? Menarche is your first menstrual cycle. Really, the body is going, I am mature enough to handle a pregnancy. That's really the onset of menarche. Okay. So this feedback loop, it applies all endocrine really. So if there is no FSH, hypothalamus releases GnRH. That stimulates the anterior pituitary to release FSH and eventually LH. That stimulates the ovary to produce the egg. As the egg matures, that produces estrogen and progesterone, which stimulates the growth of the uterus, which also simultaneously causes the negative feedback. So technically you can't get pregnant while you're pregnant. That being said, it does happen. Okay, you can go. There was a lady here in Georgia a couple years ago. Actually, I think it was like last year. 3 pregnancies. She got pregnant. Went in. They heard the 1 heartbeat. That was it. A couple months later, comes back. There's a 2nd heartbeat. When she goes to deliver, there was a 3rd baby that appeared. And the kicker of it was she lives over here alone with her parents, and her husband was back in like India or Pakistan, something like that, and he would come to visit her, and that's when she got pregnant. Then he went back for work and then came back. Imagine leaving and showing up with 3 kids when you come back. Oh no. Oh no. All right. So it can happen. It's ultra rare. What's happening is there's not enough negative feedback. And so there's this constant positive stimulation, and she was generating eggs and coincidentally got pregnant. All right, premature adrenarche or precocious puberty. These are early onset. And, you know, menarche is happening earlier and earlier. That is not because of stuff in our food per se. What it is calories. We are overfeeding our children to the point where they are maturing at an accelerated rate. Actually, they just had some study done, and it's pretty wild that in the age group of 12 to 17, 1 in 3 of those children are pre-diabetic. That is nuts. That is, we are overfeeding these children. Okay, And so really there are different stages here. The lark, that's where estrogen is starting to be released, so eggs are maturing. That means FSH has been released. Pubarch, so this is the pubic hair, that's where the androgens come into play. And then menarche. Take note, estrogen is being released at the lark. Menarche is the first period. A female can get pregnant before her first period, is my point. The egg is developing. As the egg matures, it releases LH. LH causes ovulation. If there's no fertilization of the egg is then dispensed from the body or released from the body, and we enter period. Okay, menses. So yes, a child can get pregnant before their first period. And there was a case, my preceptor in peds, she had that exact case. Mother brought in the daughter was having a weird weight gain, pain, stuff like that. And she said, the second I laid her down, I could tell she was pregnant. And she's like, we did the pregnancy test. She was pregnant. The mom argued, she's never even had her period, and had to explain that little concept there. Okay? Dysmenorrhea. So primary, this is just pain with menstruation. Secondary at different times, and really this has to do with prostaglandin release. So this is not during menstruation per se. It can be if there's pelvic disease, but sometimes women will start to have it before they actually enter menstruation. So sometimes NSAIDs can help, so you're Aleve, Advil, but then they can't be taken while actively menstruation because they increase bleeding. Right? Primary and secondary amenorrhea, so this is a lack of cycle, and primary is by age 16. We're saying this is abnormal at this point. Secondary is a lack, they've had menstruation, but then they go on 6 months without it. So one of the biggest causes is like a pituitary tumor, so that can affect it. Hypothyroidism, that can definitely affect it. As we can see, this increased production of prolactin, and that inhibits menstruation. High levels of estrogen, androgens, so if someone's abusing them or they're taking them to stop menstrual cycle. Right? And when we say estrogen, tag in their progesterone. They are not ever given by themselves anymore because of risk factors, but we give both together. All right, so what's happening when there's this excess, when the T3, T4 elevates, prolactin will also start to rise. But if there's hypothyroidism, we're sending this constant stimulation, there's no T3, T4, and in the end, we stimulate too much prolactin. That stops GnRH from the negative feedback here and stops LH, FSH. Okay. Metorrhagia, hypermenorrhea, this is abnormal bleeding, excessive bleeding. And typically you talk about this when there is some type of cancer. Okay, that is a big concern when there's bleeding and they're not on a cycle, or they're post menopause, something like that, or polyps, fibroids, any of that could cause this. And even skipping, a period for a while. So if a woman is on some type of oral contraceptive or just some type of contraceptive that is drug-eluting, she's not having a cycle, and so the uterus grows and grows and grows and like thickens and engorges with more and more vessels over time. So when they do have that one cycle, it tends to be very heavy, and that is completely normal. Right? PCOS, polycystic ovarian disease, they must have 2 out of the 3, so no cycles, the cysts in here, and higher testosterone levels. Okay, so the problem with it can cause infertility. Insulin resistance, so diabetes, so they go on metformin. Metformin can help decrease androgen production and actually increase activity of the ovary. Okay? Premenstrual syndrome, or PMS, really this is due to a fluctuation in different hormones. So women can have complaints that they don't feel normal, they feel agitated, hot. It's all these different hormones, neurotransmitters being released or not released. Right? It's all due to alterations in hormone levels. PID, or pelvic inflammatory disease, this is becoming more and more common. Really your big causations are chlamydia and gonorrhea, and we got trichomonas here. Okay? it's just women tend not to show symptoms in some of these, or they choose not to believe that they have these infections. And what can happen is it can climb up through the fallopian tube, and then you get salpingitis. That's inflammation of the fallopian tube, and you can lose the fallopian tube here. Okay, so or you damage it when you scar it, you increase the risk of fallopian tube ectopic pregnancies, because there are cilia in there and mucus producing cells, and when you damage it, you scar it, you replace it with collagen, and so as the eggs coming through, it gets stuck and it gets fertilized, and ectopic pregnancy. Okay. And then there's Fitzhugh-Curtis syndrome. This is a pretty neat one. Basically, it gets into the abdomen and it starts to infect the capsule of the liver. And so they get this really nasty infection. And then it can create all these adhesions and occlude fallopian tubes, so you can lose the functionality of one ovary in the sense of pregnancy, reproduction. Yeah. Vaginitis. So this is typically due to alterations of pH. So any of these can alter the pH. And so there's irritation, inflammation of the vaginal tract. And then Bartholinitis. This is of the Bartholin gland. And they get infected, or they can just be aseptic. They need to typically be lanced open. They take antibiotics to drain and cure it. And it just can randomly happen. It doesn't mean someone's being dirty or anything like that. It just can happen spontaneously. Uterine prolapse. This is a pretty wild one. The uterus comes out of the body. Okay? There's bladder prolapse, there's rectum prolapse, and really a lot of it is to increasing abdominal pressure. When it gets too much in there, it's got to go somewhere and it pushes out. I had a preceptor tell me a story, and because a lot of like what we're talking about here in reproductive is taboo in a lot of cultures. They don't talk about it. It's just unspoken. Okay. So the stories you hear are pretty wild. So my preceptor told me he had an older lady. She was like from India and like in her 80s or something. Refused to go to the doctor. Finally, the family drags her in. He said when she took off her underwear, her uterus was just hanging there and had been hanging there for several months. She just did not want to go see a doctor, thought it was weird to show people, stuff like that. I've heard stories about new couples having sex during menstruation, thinking that's when they get pregnant. I've even heard an extreme case where they thought they just lie next to each other. You'll be surprised. So one of the things when couples are having issues with pregnancy, that's one of the conversations you have is, what are your sexual practices when, it may be something as simple as that, not anything actually physically wrong. Right? Cysts are encapsulated sacs. What's in them can be different. So the first one we have is ovarian cyst. And this is when the egg is released, it usually just goes away. It's not a big deal. They can be painful because they're large, they swell, all of that. Follicular cyst, this will fill with fluid. And then luteal, it will fill with fluid. It can release it can refill, it just bounces around. Okay. Dermoid cysts, these are pretty wild. These are the ones where you hear about like someone like, oh, I had a twin that I ate. And the reason is it's the original tissue, so it grows all kinds of things like hair, teeth, all kinds of stuff. They can get rather large. Okay? And if you're really interested, look up, you can Google it, abdominal ectopic pregnancies that have calcified. There was a lady where Doctors Without Borders went overseas and they pulled out of this older lady, like postmenopausal lady, a fetus that was, I think they said it was like 40 pounds. It had calcified. The body just walled it off because it didn't know what to do with it over the years. But yeah, she got pregnant at some point. It was abdominal pregnancy. It reached its demise and the body just walled it off. It is impressive that she survived. That didn't become necrotic. Like, wild. Okay. Polyps. So these are growths or fibroids, leiomyomas. They grow, they respond to estrogen and progesterone, so they can cause pain with menstrual cycles, stuff like that. Malignancy is rare, but you can go and you can remove them, but usually because they're so embedded in the myometrium here, these are the real painful ones. They end up, once they've had children, if they can, or they choose not to, they will have a partial hysterectomy where we remove just the uterus. Total hysterectomy is you remove also the ovaries. All right. Endometriosis, so this is endometrial tissue. This is the most superficial layer of the uterus. It has glandular material in there. It responds to estrogen, progesterone. It stimulates it to grow. The problem is it can be anywhere. I've heard of it in the thorax, like up on the lung lining, on the diaphragm. So typically they can scrape them out. Typically it's really in the uterus. That's where they see it. So they end up with a hysterectomy as well. And so endometriosis, taking birth control pills stabilizes them. They're not going peak and valley, grow and shed and causing pain. Same thing with pregnancy, because there's no estrogen and progesterone fluctuation. It's constant, right? And endometriosis will be a lifelong problem? No. Postmenopausal, it should disappear because there is no estrogen and progesterone to make it grow anymore. There's FSH, but that's not going to do anything to it. Cervical cancer, so this is why we do pap smears. HPV is the biggest causative agent. There's actually, now I think it's like 6 different strains that cause cervical cancer. They change now when they do pap smears. I think it was like every year. And now they change it to every other year or every 3 years. I almost want to say every 3 years now. They've reduced it because they found agitating it can trigger, mutation over time. And it just doesn't grow as fast as we thought. And so they've learned it's less risky to spread it out a little. Endometrial cancer, so here's our endometrium. And it's all damaged here. But endometrial cancer is typically late menopause is where we see it. So this is like this abnormal bleeding in a woman that's in her 50s, 60s. She shouldn't be having a cycle. So if they say they're bleeding, randomly spotting, anything like that, it needs to be investigated immediately. And the easiest solution really here is just a partial hysterectomy. Ovarian cancer, this is extremely severe. You're looking at the abdomen there and all that's growth. The problem is when you talk about ovaries and testicles, both originate in the abdomen, the ovaries stay in the abdomen, the testicles descend. And so there's this pathway to the abdomen essentially and surrounding tissue. And so it spreads very, very rapidly if it's not caught early enough. Male reproductive disorders, so priapism, this is erections that will not go away. The problem is blood is not circulating through the tissue, and so the tissue dies. Okay? Hypospadias, and there's epispadias. Hypo is on the lower side, so like if the father had it, the son tends to have it. There's a genetic connection there. And what's happening is the urethra enters from the bottom, so hypo below, and not at the tip of the penis like it should. So they surgically just correct it in the baby and move on. Epispadias is on the top, and the way you remember that is if you pee and there's a hole on the top and you pee in your eye. I didn't come up with it, okay? But now you're going to remember it forever. Variocele. So what happens here is the veins dilate essentially, and so they refer to it as a bag of worms is what it'll feel like. The problem with this is it heats up the testicles. So the testicles descended from the abdomen down and need to remain cooler than the rest of the body, or the sperm die. Okay, so that's another concern when a couple comes in and they're asking about reproduction issues, stuff like that. The male needs to be talked to about habits. So like if they're sitting in a hot bath or a hot tub every day after work, that's their favorite thing. Well, that's probably the problem. Once they stop heating up the testicles too much, their fertility will return as normal. Okay? So this variocele can be it needs to be surgically corrected. Okay? Tunica vaginalis, so this is the layer around the actual testicle, and fluid can get in there and they can have what are called hydroceles. That's a hydrocele on the left, so you can shine light through it and it'll light up. It typically goes away on its own. There's nothing really to do there. They don't need to drain it. And then spermatocele, that's where the sperm cavity gets filled. Okay, so like a cyst in there, and that can be surgically drained. Not a big deal. Orchitis, so this is inflammation of the testicles and can cause permanent infertility. So one of the things that causes it is mumps. So it's called mumps and bumps. It infects the parotid gland in your cheek, and in males can infect the testicles and causes infertility. Kid won't know till they're an adult trying to have a kid, infertile. Okay? Testicular cancer, pretty rare. There are a couple out there. So there's one called I have on here, adenomas. So there's like glandular tissue that generates a pretty good recovery. There's one, it's called an egg yolk sac tumor. So you may have heard stories about like some girl lets her boyfriend or husband, whatever, pee on a pregnancy stick, or for some reason the guy just pees on a pregnancy stick and it turns positive. They're like, oh, it's not accurate. It is accurate. What's that telling you? The egg yolk sac tumor, for some reason, releases a beta HCG, which is what we test for pregnancies. So if a male turns a pregnancy test positive, they need to go get checked for cancer because they probably have testicular cancer. Prostate, so only males have prostate. It surrounds the urethra. The problem with the prostate is, as males get older, it's an inevitable. It's benign prostate hyperplasia, but it's actually a hypertrophy. Hyperplasia is increased number of cells. That would be prostate cancer. The terming is wrong. Hypertrophy is an enlargement of cells. So it enlarges, it occludes it, they have trouble urinating, all that. PSA is elevated, so that's why typically when they see an elevated PSA, it doesn't just immediately mean prostate cancer. It can be BPH. And nowadays they do a couple different procedures. They can use a laser to zap it. They go in through the urethra and zap it, or they use water pressure, and they basically pressure wash it and break up the tissue, and that's the end of it. Okay. Prostate cancer, you can see different countries. This is a little bit older chart, but still lots of value there. So you can see certain cultures are hit more than others. And then it's also identifying. So, there's a problem when you get to certain areas, like they don't have doctor access, it's a village doctor or something like that. So they may die from something and it's never reported. So the numbers in poorer countries probably are higher than your westernized nations. And then prostate cancer, you can use what's called the Gleason score. So they go through, they grade it. Digital rectal exam is the best way to check prostate, so that's why it becomes part of preventative medicine in males starting, I want to say it's age 45. I think they moved it down to 45 from 50. It used to be, and I think colonoscopy and it shifted down. Right? So I had a buddy, he's a horrible guy. He passed away, unfortunately, but horrible sense of humor, and he's like, yeah, I'm getting at that age where I'm shopping for doctors by the size of their hands. I was like, oh, Lord, Jeff. Oh, Jeff. But yeah, by the size of their hands. Prolactinomas, so excess prolactin can cause galactorrhea, so they're producing milk in females when they are not pregnant or recently pregnant, so that can be a sign. Okay? And then certain dopamine blockers can cause this, so certain medications can trigger galactorrhea as well. And then ductal carcinomas, so this is of the actual ducts inside the breast tissue, and they tend to ooze out like bloody discharge, and that can be a sign that they have this ductal carcinoma.